paramagnetic rim lesions, which are also called as PRL, that occur in people with multiple sclerosis, are characterized by iron-laden active macroglia and macrophages at the rim of the MS lesions. And these PRLs were shown to have higher inflammation measured with TSPO PET, and these lesions are also found to be associated with higher motor impairment and cognitive impairment. However, it wasn't clear how these PRL lesions are impacting the white matter streamlines beyond the lesions in terms of their disconnectivity level and association with inflammatory activity. Therefore, our goal was to look at the differences in inflammatory activity measured with TSPO PET in subjects with PRL and without PRL. So we grouped our subjects, MS patients with at least one PRL and MS patients without any PRL lesions. We also look at the association between disability and inflammatory activity measured with TSPO PET in the white matter streamlines. So we used a cohort of 40 people with an average age of 45 years old, and we use expanded disability status scale to measure disability. So EDSS is the range between 0 and 10. 0 means no disability and 10 means death due to MS. And we use quantitative stability mapping, QSM, to identify PRL lesions and distinguish PRL versus non-PRL MS lesions. And to measure the disconnectivity level, we use a network modification tool that estimates the percentage of the streamlines which are passing through an MS lesion. For example, if there's a voxel and if there's a 10 streamlines on that voxel, and if 10 of them are passing through MS lesions, it means that this voxel is completely disconnected. And if there's 10 streamlines from a voxel, and if one of them is passing through MS lesions, it means that only 10% of this voxel is disconnected. And if none of them are passing through MS lesions, it means that this voxel is not disconnected at all. It means that we can call them a healthy voxel or undamaged voxel. So in this study, we separated the white matter streamlines or white matter voxels as healthy. It means that they are not disconnected at all, or extremely damaged due to MS lesions, and between 0.9 or 10. It means that 90% or 100% of the streamlines are passing through the MS lesions. And we found that MS patients who had at least one PRL had increased inflammatory activity in healthy voxels as well as extremely damaged voxels compared to subjects without PRL. We also found a significant and strong positive association between inflammatory activity, which is measured with TSPO PET, and EDSS only in subjects with at least one PRL. But we didn't find any significant positive association in subjects without PRL. Our results indicate that people with MS who had at least one PRL have overall increased inflammatory activity in healthy voxels and also in extremely damaged voxels compared to subjects without PRL. And inflammation is significantly associated with disability in MS patients who had at least one PRL. For now, we are only using TSPO PET binding potential, and the next step is to also look at DVR. It's a different way of looking at inflammatory activity in MS patients. And we also aim to look at the association between inflammation and disconnection at different disconnectivity levels. So what is the correlation or association? And another next step is to also look at the association. For now, we only look at the correlation, but we also need to look at the association by taking into account age, disease duration, treatment duration, and other neuroimaging and clinical features.